right, Dr. Adams, thank you very much for being here. So I'm a newsman, and so being a newsman, I cannot ignore the news that was made by Mike in his opening remarks and his very strong words about the nomination of Robert F. Kennedy Jr. to be Secretary of Health and Human Services, which just put on your former Surgeon General hat, your medical hat, your reaction to the nomination and to the words that Mayor Bloomberg had to say.
Well, thanks so much for having me here today. And I would say, number one, the mayor emphasized that our healthcare system is broken. We spend 2.5 times the OECD average on healthcare. We have terrible, terrible results by any metric. So the definition of insanity is doing the same thing and expecting a different result. I think we have to acknowledge that. You know, the Senate's job is to advise and consent. I think, as the mayor mentioned, there will be a lot of questions that an RFK or any other nominee has to answer if they hope to get confirmed. But for me, I choose to look at some of the opportunities. And the mayor mentioned the life expectancy differences between us and the UK. He mentioned chronic diseases. He mentioned drug overdoses. He mentioned guns. I certainly think that at least the things that RFK is talking about in those spaces are opportunities for us to work with the next administration, no matter who actually ends up being secretary. So yes, we need to improve our community so that we can lower chronic disease rates, more opportunities for exercise, more opportunities to eat nutritiously. RFK is in recovery. Who better to lower stigma and to talk about these issues than RFK? I think that's something that even if he's not confirmed, I hope he leans into. And we obviously know that RFK is not someone who's in favor of widespread availability of guns. So I think there's a lot of opportunity that I don't want us to miss.
Mm-hmm. So the title of this session is Bridging Divides in Public Health. What is the divide?
If only there were one.
Is it a political divide or is it something else, or all of the above?
I think the political divide is the obvious one, and it's the one that we pay the most attention to. We've literally in this country taken every issue and turned it into Democrat versus Republican, abortion, guns, access to health care, drug policy. We take everything and we make it binary. And it's what separates us from many other countries. I do a lot of work with Switzerland and Ireland. Their constitution is based on our constitution. They literally both wrote their constitutions based on ours. So it's not a problem with our constitution, but they actually have multiple parties. They don't force everyone into these false binary framing scenarios. So I do think it's political, but it's also rural versus urban. You see that. You see a lot of rural America feels like they've been forgotten about. I'm in the Midwest. Someone asked me earlier, are you surprised Trump won? I'm from Maryland. I come out here all the time. You come out here and you'd be surprised he won. You drive anywhere through Illinois, Indiana, Ohio, it ain't no surprise he won. And those parts of the country feel forgotten about. So rural versus urban is a divide. So many other divides out there that I think we need to try to bridge. And I'll finish with this. I'll say there's more that we have in common than what there ever could be that separates us. And we have an entity in Washington, D.C., and in many cases the media, that thrives on us focusing on our divisions and not what brings us together. I've lived in Berkeley, California, and they thought I was a Tea Partier there. And I live in Hamilton County, Indiana now, and they think I'm a socialist. I'm the same person, but guess what? I've had dinner, I've broken bread, I go to church, I go to school events with people in all of those communities, and I call them neighbors. I think that's what we need to focus on.
What role does misinformation play in the divide, especially when it comes from people in positions of high authority? Isn't this the challenge that we face today?
Misinformation is a grave challenge, and the current Surgeon General, Dr. Murthy, put out an advisory calling on us to recognize misinformation as a challenge. I'll actually flip to solutions. I think we need to do a better job of training all the people in this room how to communicate. I'm a doctor. If you ask me a medical question, I've been trained to give you a 45-slide PowerPoint presentation in answer to that question. I've not been trained to go on your show, Jonathan, and answer the question in a 2 to 3 minute oftentimes combative interview where I'm trying to get out my talking points.
Never on my show.
Well, you've never invited me on your show.
We can change that.
So that said, we need better communications training. We need to learn how to be on TikTok. We need to go on podcasts. Joe Rogan is going to continue to be the most trusted person on health for many folks out there if we don't know how to interact in his space. And so many of you follow me on Twitter. I get a lot of flack for being on Twitter. It's not professional of you, Dr. Adams. Well, most people, even healthcare providers, get most of their medical information online. So if we're not there, and the Joe Rogans of the world are, we're going to continue to lose. We need to figure out how to communicate in this space, and we need to learn how to speak to our target audience and not to each other in these echo chambers.
Dr. Adams, one more question on this. Then how should we respond to an elected official? I don't know why maybe if I sit like this and don't move, my mic won't go out. How should we respond to an elected official who is the person who is disseminating misinformation, disinformation?
Well, and again, it depends on who you are. The media has a role to individuals out there. Your job is to recognize that misinformation, which the Surgeon General helps us do, and to, if you don't agree with it, then to vote them out of office. That is how democracy works. But here's the challenge. Who's going to be the arbiter of what is and is not misinformation? And I'll give you a very concrete example because I don't want to talk in platitudes here. Joe Biden said that we had a pandemic of the unvaccinated. Was that misinformation? We subsequently found out that the vaccines aren't great at preventing infection. They're great at preventing severe disability and death, but they're not great at preventing infection. So was that misinformation? I don't know. It depends on who you ask. Joe Biden also said, and I talk about this in my book, that if he was president, he said, when you name me president, I will enact a federal mask mandate. He's leaving office in a few weeks. Has he enacted a federal mask mandate? Was that misinformation? And I don't say that to criticize Joe Biden by any means. I say that because it's really hard for us to determine, okay, this person is wrong, this person is right, and oftentimes what we saw in the pandemic is information changed and that information was politicized, and ultimately we lost trust. We lost trust because the people who were saying something was misinformation were subsequently shown to be wrong.
In the 4.5 minutes that we have left, and I'm not going to belabor this point, I'm just going to make this, I got to sit like this again.
See, the mic doesn't like you.
I know, clearly the mic doesn't like, oh, thank you. Just to be clear, there are several things you said about current President Biden, but let's just be clear. Former President Donald Trump said to people that they should ingest bleach. So it is...
Actually, no, he didn't. Please read my book. Again, this is misinformation right here. He did not say you should ingest bleach. Read my book because we don't have time to go into it, but people keep repeating that. Look it up. He did not say people should ingest bleach. We had a conversation at the White House down the street, led by scientists, talking about disinfectants that we could use to help combat COVID. And I talk in the book about how the president, I will say this, he should not be opining about scientific issues while the scientists are standing next to him on stage. Please let the scientists and the doctors talk. But he never said ingest bleach. Look it up. Call me out on it.
Okay.
So is that misinformation or not?
In the 3 minutes and 17 seconds that we have left, can you share examples of efforts you've been involved in to advance health in what may seem like surprising ways, working in a red state where you live now in Indiana? Let's just start with Indiana.
I appreciate the opportunity to talk about this because a lot of people, the mayor said a lot of things I agree with. He also left you all feeling terrified. And a lot of people are scared right now. But I want to tell you, with crisis and with turmoil sometimes comes opportunity. So I was Indiana State Health Commissioner under Mike Pence, who at the time was one of the most conservative governors in the United States. Mike Pence now is not even considered, Republicans call him a Democrat now, but at the time he was one of the most conservative governors, and we were able to expand Medicaid in our state, one of the first red states to do it. We were able to expand syringe service programs in Scott County, Indiana. And we also, if you can throw the slide up there, were able to actually increase public health funding in our state by 1,500%, $250 million in our state. So I tell you that because there are opportunities if you learn how to communicate with your target audience. I'm going to give you all some cheat codes here on how to speak Republican. This is based on my experience. Number one, you really have to understand there's a value placed on individualism and choice. And so I often talk about we need to create opportunities for people to make healthy choices by building healthy communities. That's something I say that often resonates with Republicans. Another thing that Republicans really care about is the economy and the workforce. So I work with employers. I put out a report when I was Surgeon General of the United States that we made in concert with the US Chamber of Commerce, talking about the impact on workforce and the economy. Transparency, I think we need to do a better job of making sure we have local data. Local data. Real statistics, 70% of people think they're above average drivers.
Oh, I know I am.
I'm going to let that sink in. And the point is that everybody thinks there's a problem. Nobody thinks the problem is in their community. So we need to leverage AI and data to give people real-time data. Again, I would say that if you do these things, if you make the workforce and economic case for health, then we've proven over and over again in Indiana that you actually can move forward public health initiatives.
In the 42 seconds we have left, how concerned should we be about H5N1?
I'm very concerned. And number one, I'm concerned because you're starting to see it jump into more and more animal reservoirs, so it could really get to a point where we have human-to-human transmission. And I talk about this all the time on Twitter, on my social media channel, but here's what I'm more concerned about. Again, teaching you all how to speak Republican. I'm not as concerned right now about human transmission. I'm concerned about the fact that 30% of the bird flocks in California have seen infections, that egg prices are going through the roof, that our food supply and our economy are going to be impacted if we don't really lean into bird flu. So we need the new administration to really have a strong pandemic response policy, because if not, then all their other priorities are going to get distracted from.
And with that, we're going to have to leave it there. Dr. Jerome Adams,
on your show.
20th.
Buy my book, Crisis and Chaos. It's on Amazon. I talk about all these issues in the book, including the bleach story.
20th Surgeon General of the United States. Thank you very much.
Please welcome Dr. Thomas Dobbs, former Health Commissioner, State